Members of our community can't access those resources. We put money in to help small businesses. Members of our community can't access those resources. That's what the API equity budget was about. It was actually building those bridges so that our community can access those other resources that are even actually, by the way, even larger, much larger than the amount we have for the entire API equity budget.
Welcome to the Ronin Project Podcast, a show about Asian Americans in politics, rocking the boat, breaking the rules, and taking on the big fights. I'm your host, Bill Wong. Buckle up, it's time for Ronin's To Roll program. Hello, Ronin Nation. I'm excited to have a very special guest on the show this week. Dr. Richard Pan is a pediatrician and currently the Senior Policy Advisor to AAPI Data. He is a former UC Davis faculty and a former state senator and state assembly member representing the Sacramento region. He is the first Asian American to represent the City of Sacramento in the California legislature, where the Transcontinental Railroad began over 150 years ago. Dr. Pan is immediate past chair of the Asian American Pacific Islander Legislative Caucus and was chair of the Senate Select Committee on Asian Pacific Islander Affairs. Dr. Pan led passage of the $165 million API equity budget that was signed into law in 2021. And that was the largest amount that any state in the United States has allocated in their state budget to address API equity and API hate. Prior to serving in the legislature, Dr. Pan was a UC Davis professor and director of the Pediatric Residency Program. Welcome to the show, Dr. Pan.
Well, thank you, Bill.
It's good to have you. Let's start with your journey in politics. Obviously, you're an accomplished doctor. How did you get started and how did you get to where you are today?
Well, frankly, when I grew up, my parents were immigrants from Taiwan. They thought it was very important to vote and be civically engaged, but getting involved in politics was not something they encouraged. So there was no, I want to be president when I grew up. For me or my brothers, we were frequently one of few Asian families in our communities that I lived in. We did not see anyone who looked like us, and certainly in elected leadership and leadership in general. As immigrants, I think my parents were concerned about sticking out more than we already did. I mean, we were objects of curiosity in many of the neighborhoods we were in because we stood out, right? My parents spoke with a little bit of an accent. We looked different from everyone else. So we really stood out. And to stick out more by being engaged in politics was not something that was probably a good idea for us.
I know you're heavily involved in the California Medical Association and the medical profession. Was that your first exposure to the world of politics?
So I would probably say is that as I decided to choose medicine as my career, that was not something my parents wanted, something I wanted. As I was pursuing medicine as a career, my initial thought is that I was going to discover the next great cure, as they say, right? I was a biophysics major in college, want to do lab research, figure out the gene expression, all that other cool stuff that scientists do, right? As I went through medical school and then residency, one of the things I started to realize is that we need people to discover the next great cure. God bless all my colleagues who continued on that journey. But we also need people who are looking at the impact of communities so that people have access to those great cures other people are inventing, right? So that's access to care. We know that community environment, social environment, physical environment has a tremendous influence on people's health. So I sort of went down that path and said, well, that's actually where my interest and passions lie, right? How do we make a better healthcare system? How do we improve communities that promote health? What can we do to change those social and physical environments in which people live so that they're healthier for people? Well, when you start talking about social in terms of health and those types of environments, you start talking about politics, right? It's government that sets the rules that oftentimes will make us either healthier or not. It's government agencies represent the collective will in a democracy, at least, of what the people want to see happen. And so as I went through my medical career, I realized that I have to be more involved in advocacy. And that means also being involved in politics. In fact, as a resident physician in Massachusetts, I served on the Medical Society Leg Committee. And then when I came over to California, did the same thing, ended up chairing the CMA's Council on Legislation, but was also involved in the community in many other roles, served on the First Five Commission, worked with not-for-profits and government to try to get kids healthcare coverage, right? We started Healthy Kids, Healthy Futures, which was a collaboration between the First Five Commissions, United Way, medical societies, other not-for-profits, where we essentially helped 65,000 children in 5 counties get healthcare coverage. And then other things we were doing to try to, again, improve communities. And so that sort of led me down the path of not necessarily wanting to run for public office quite yet, but saying that, well, certainly government has a very important role to play and I need to be involved. And then the Great Recession hit. What I saw in the Great Recession was that, for example, not-for-profit that was funding children's healthcare coverage, funds got cut, both from foundations because their investment returns go down, but also government was looking at places to cut. The work that I was doing as a pediatrician, taking care of children with learning disabilities and behavioral issues, I noted that because of state budget cuts, their services cut. My family ran a small business. My wife has a dental practice. We saw how that was impacting her business and other businesses around her. And at that point in time, I finally said to myself, well, if I'm not willing to run, despite all the conditioning I had all the way up to this point, like, no, we shouldn't be involved in politics, right? Our family would never get, someone like us would never get elected, right? It's that, well, I'm not willing to at least try. How can I complain about what happened? So that's when I decided to throw my hat in the ring and run in the 5th Assembly District at the time in Sacramento. It was certainly not an Asian district. It was a majority white district that was actually a safe Republican district. And frankly, even the Democrats, when I put my hat in the ring, looked at me and said, well, someone who's never held office, Asian in this non-Asian seat, and said, well, we can't put forward an Asian. An Asian can't win this seat. And so that was the first response I heard from fellow Democrats about the seat. I should mention, since this is Pride Month, that the main Republican candidate was actually the author of Proposition 8, which had just passed 2 years ago, not only in the state, but in that particular district as well. So I want to make note that it's important to talk about the people who came before you, right? And one of the things that we were able to point out to my fellow Democrats who said an Asian couldn't win this seat is that we looked at John Chung's race for controller when he was running against Joe Dunn, an Asian man with a clearly Asian last name. He had actually won in that district over Joe Dunn in terms of number of votes in that district. And I think that proved to people, that showed to people that, this perception that an Asian can't win in a non-Asian seat, that white voters, as well as other voters of color, won't vote for an Asian to be elected to represent them, was wrong. Because of that helped at least convince some of them that they should really take another look at my campaign.
Let me ask this. Do you think that when people think about Asians, they don't think that they have that type of leadership quality that is required to be successful in elected office?
I think, unfortunately, people, when they look at Asians, they don't see leadership. This is where the so-called mono-minority myth cuts in, right? So we're smart, hardworking, we're diligent. Hopefully those are things you want in a leader. So someone will work for you, who works hard, but those aren't seen as leadership qualities, right? Unfortunately, we see this not only in politics, but across the board. So I'm a physician. People often say Asians are overrepresented in medicine. By the way, I should mention that perhaps only applies to certain Asian subgroups, South Asians, maybe Chinese, Japanese, a few others, but it doesn't apply across the board. There's many, particularly Southeast Asians, are underrepresented in medicine. But if you look at the percentage of faculty in medicine, I think we're like 25% of all the faculty members in medical schools. But if you go all the way up and look at who's at leadership in medicine, Asian Americans, actually, interesting enough, they don't publish the data on the percentage of deans who are Asians. So you can't get that data, but you're able to glean what percentage of vice deans. The number of vice deans who are Asian American represent the smallest number of all racial ethnic groups, not just white, Black, Hispanic. We're the smallest, even though we start off as, quote unquote, the second largest racial ethnic group in the faculty ranks. Why is that the case, right? And so that's medicine, of course, because I'm a physician, but we see this, and we had a hearing of this as our select committee. We see this in journalism. We see this in law. Goodwin Liu, a Supreme Court justice in California, actually looked at the judicial ranks and saw this. We see this in entertainment. So it's good we're having sort of this kind of renaissance at the moment in entertainment. And tech, Buck G and Ascend have a lot of data where it basically says, Asian Americans are the least likely to get promoted in corporate America, particularly in tech. Of course, Asian women at the very bottom, even though we fill many of the ranks in engineering and other professional positions at entry level, by the time you get to leadership, we are among the lowest, if not the lowest, in representation. And so that becomes a challenge when you're running for office, because that sort of reflects society, right? Society doesn't see Asian Americans as leaders. Interesting enough, even though the countries and cultures from which we came actually dominated world history for most of world history.
Great points. And along those lines, so you obviously won elected office in a underdog race for assembly, and then you're in this massive fight for the state senate and won that seat. So how did you do it? Considering all of these barriers, like people underestimating you, people not thinking that an Asian can win in quote unquote a non-Asian seat, like all of those types of things would be very daunting to other candidates. But what did you do and what went right for your campaign for you to be able to succeed so amazingly in your races?
It had to do with my record of getting things done and solving problems. Now, I don't think that's unique to Asian candidates, but I believe that record, someone who's accomplished not only in politics but also as a physician and getting things done, the work I've done in the community and not-for-profits. And frankly, when I ran, I spent less time talking about what I promised I would do in the future and spent more time talking about what I had already accomplished, and giving me an opportunity to try to continue that and further that work in the legislature. So I think those are some of the reasons. It is important to recognize that we do have this challenge as Asian candidates to try to get people to see us as leaders. Now, I would also point out, though, in the past, since my race, that was about almost a decade and a half, not quite, ago for the assembly. And then 4 years later, when I ran for the Senate race, which again, no one thought I would win. I was not the favored candidate for that as well. We've had other Asian candidates who've been successful also in flipping seats, as they say, at least from Republican to Democrat. Al Marisucci in Los Angeles was able to take a Republican seat. And then Dave Min, almost 4 years ago, actually defeated a Republican incumbent for state Senate. So defeating incumbents very challenging in Orange County. I think that demonstrates that Asian candidates, despite some of the challenges and barriers we have been successful in actually bringing people together and sort of bridging divides to win difficult elections. And I think that proves certainly here in California, where Asian candidates have been particularly successful in what's called flipping seats, but it's because we were able to message and work with voters of different backgrounds to be able to build the winning coalitions.
I think a lot of candidates think that it's just your credentials, and obviously you have tremendous credentials, but what role did, say, the Medical Association or organized labor or other entities have in your race?
They played an extremely important role. So it's interesting you start off talking about credentials. So I think you've mentioned this, and I agree with you. No one cares. They may not even think it's a good thing that, let's say, I went to Harvard for School of Public Health, that to go around and say, oh, I went from Harvard, right? Frankly, the voters don't care. And in fact, they might think it's a little arrogant to be talking about that. It's less about credentials. There's a lot of people with credentials, by the way. Asians aren't the only ones with credentials, but that is a challenge for a lot of Asian candidates, because oftentimes our families like to boast about our credentials to each other and to our fellow family members and people in the community. It is something actually Asian communities actually appreciate. People have been accomplished in terms of their credentials representing their accomplishments. But in general politics, not so much. And in fact, going back to what I talked about, it's not about my credentials, about the things I've done, right? I helped 65,000 children get healthcare coverage, right? That's something quantifiable, meaningful, right? We put together a safety net coalition to help keep clinics open and actually expand clinics in the community, right? We've created jobs as a small business owner, right? So things like that, I think, are particularly important. And I think those are the types of messages that other Asian candidates as well have used successfully.
One of the things when you're running for the assembly, I was working for the Asian American Small Business PAC at the time, and we were raising money specifically to grow the number of Asian Americans in office. And we contributed to independent expenditure efforts in order to support your candidacy. But I would be very honest, it was very difficult for us to raise money. In fact, I would say 90% of our money did not come from Asian American donors. It came from a variety of other sources. And the Asian American electeds were not as helpful as they could have been with regard to supporting the PAC. And I know you've talked about this in the past, and I want to leave a lot of that stuff in the past. But looking forward, what do you think the Asian American community, Asian American other electeds, and the Asian American community leaders need to do if we're going to create a sustainable representation in the halls of power for Asian Americans?
Let's put it this way. As you asked earlier, When I ran for office, certainly California Medical Association, organized labor, I'm a proud member of AFSCME, played a very important role in helping fund my campaign. Certainly, they support a wide variety of progressive candidates, so they're not looking for the Asian American candidate. But the Asian American Small Business PAC was looking to support Asian American candidates. There are other PACs that do the same thing for other racial ethnic groups. And I think that for our community, if we want to see more representation in politics, we got to step up like other communities have. It is important that we have Asian American PACs that are able to raise money from our own community. As chair of the API Legislative Caucus, I've worked to try to get more Asian Americans elected to the state legislature and to other positions as well. So we get money from unions, I get money from healthcare entities and so forth, but we also need to get money from our own community, right? And so we want to see not only representation, but a seat at the table, right? So I know you've said, Bill, you don't ask for a seat, you have to take it, right? And so we're going to take any seats so that we actually are at the table and not just standing at the edges watching what other people are deciding, then we do need to step up and help out, right? And contribute. In many ways, when you look at the AAPI community, there are actually a lot of resources in the community. And so the question is, how do we as a community mobilize those resources to help ensure that members of our community are at those tables of power when decisions are being made?
Yeah, and I think having people like you in positions of power is super important. I know that you were a big supporter of Stephanie Wynn, who won a very competitive seat for state assembly in the neighboring district. A while back, I actually interviewed Dr. Arvind Venkat, who's in Pennsylvania, and he was saying how little there are with regard to health professionals in the legislature and how important that voice is. And you were there at a time when we were dealing with COVID and also all these other types of healthcare issues. Like, how important do you think it was being a doctor in the legislature that's filled with mostly lawyers?
Well, I think it is important that we have physicians in the legislature, particularly physicians who are recently in practice and if hopefully still able to do a little bit. It's a full-time legislature, so I continue to see patients at a community health center. I tell people that at the beginning of the week, I helped shape the rules as a legislator. At the end of the week, I was into practice and I had to live by them, right? And I take care of the kids and their families who came to see me. I guess the one advantage I had over my colleagues is I actually had the cell phone number for the director of the Department of Healthcare Services that ran the Medicaid program, whose patients I was seeing. So I mainly took care of Medi-Cal patients. It's important that we have people who bring a variety of experiences to the legislature, and certainly medicine is one of them. I mainly took care of kids who were from under-resourced communities and low-income families, and brought that perspective back to policymaking in the legislature. And hopefully, in my 12 years, I've made lives at least a little better for them than it was when I came in. That type of work is really important. But I also want to mention is that, in addition to the physician hat, also the AAPI hat, right? As someone who grew up and knew what it was like, and frankly, I had a lot of advantages. Okay, I was not the child of someone who was an illegal immigrant. My parents were highly educated engineers, right? By the way, that's who they let into the United States from Taiwan. So I was fortunate to have, middle-class parents. But even in their middle-class status and, income and their education, we faced our own struggles with racism, with discrimination. I guess one example is, by the way, I started off in elementary school in first grade in special education because I mainly spoke Mandarin at home. I didn't speak English. And so they thought that, oh, well, this kid isn't very smart, and we needed to put him in essentially what was then a special ed type class. Special ed didn't really start for a couple more years. But so I do tell people you can be in special ed and you can still be a doctor. I did it. Frankly, part of that was also because the school is not being that supportive of dual language families and immigrant families, right? So bringing that kind of experience is important as well.
Well, let's talk about impact. You helped pass the $165 million API equity budget. I think the only state that came close was New York, and I think they passed something like $46 million. So, I mean, this is more than 3 times the size of that. The biggest investment in the API community I've ever seen from a legislative standpoint. Can you tell us a little bit about that effort and how you shepherded it and how it felt to actually get that signed into the state budget?
Yeah, no, that was a tremendous effort by our community. Frankly, the groundwork was laid even before I was chair of the AAPI Legislative Caucus. I could choose now the first Asian American city attorney in San Francisco, of all places, right? He started some conversations about, well, what are the needs in our community? We were fortunate enough that the AAPI Commission, we were able to get some funding so that they could get staff. This is before the API equity budget. So the commission was finally staffed, and that enabled the commission to be a bit more active and to take on more work. And so we worked with the chair of the commission as well, Dr. Rimikashnan, and then many of the leaders of advocacy groups, the Stop AAPI Hate folks, Manju and Carolyn and Russell. We clearly saw a rise in Asian hate that, with Donald Trump intentionally saying China virus and Kung flu, right? You saw API businesses being affected by the pandemic because of the news of COVID and the pandemic. And then we saw, of course, increased hate. But then what happened in Atlanta with the murders of the Asian women really put a spotlight onto how vicious this hate was. That tragedy also created an opportunity to have a conversation about, look, here we are in California. Almost 1 in 6 people is Asian American. It took not-for-profits, our community's not-for-profits, to collect the data that then we could use to advocate and say we needed more, right? Our community needed support. We have a lot of people suffering from hate and violence. So we put in funding for not only Stop AAPI Hate, but for data equity, right? Because oftentimes when we look around, there's very little data. And so first thing you said, I want to do something. Phil said, so what's the data to support that? And well, no one's collected the data. So that doesn't work very well. I want to also thank Phil Ting, chair of the Assembly Budget Committee, because he and his staff were able to give us some insights into some of the budget thinking and process was. Of course, I continue to serve on the Budget Committee in the Senate. And so we were able to coordinate between the two houses. But then we also had over 100 AAPI organizations actively calling for this funding. We originally asked for about $200 million. The counter offer back, I think, was $30 million. We said no. It was not a given. We talked to Governor Newsom, and we were able to have a conversation with him. He recognized the importance of this money, the importance of actually supporting our community. One of the big challenges we've had is actually how do they handle getting this money? So I'm very proud we got this through, right? We continue to work on implementation, right? So of course the administration implements, but we continue to be involved in that implementation. And also working with the not-for-profits out there, we've realized we have to build their capacity too. If someone just shows up and says, hey, I have, a couple $1 million for you or $10 million, you got to have the infrastructure to handle it, right? To be sure you're using it effectively, you're doing it well. So we recognize that we need to do that as well, but it also needs to be sustained. Some of it also need to be and was invested in building that infrastructure to handle those funds. It's certainly not enough for our community. It really is to help our community to get other resources that are basically available to the general population. It's not funding all the mental health for Asian Americans. In fact, Asian Americans should be able to access general mental health services, right? The problem is we have barriers to that, language barriers, cultural barriers, other types of barriers. It's really important for people to realize that funding like this should be to build bridges to mainstream services that government already funds. I think it says something, though, the fact that we need that, because that means that the members of our community can't access those resources. We put money in to help small businesses. Members of our community can't access those resources. That's what the API equity budget was about. It was actually building those bridges so that our community can access those other resources that are even actually, by the way, even larger, much larger than the amount we have for the entire API equity budget, so that our community can tap into that, so that we can actually have the same access to resources as other people, because that's equity, that's justice, right? That we should have, our community should have the same access to the same services and resources that the rest of the people in the state do. That's why we need to continue the funding for that budget so that our community can continue to have our fair access to the services that government's providing to the people of the state in which we live in.
So there is a definite connection of having people who are at the table to be able to get what is fair for our communities in the government space, right?
Right. Commission established. We got funding for one staff person for the commission, but that made a huge difference. Our caucus itself has grown. A member of our caucus became chair of the budget committee. That was so very important. I became chair of the Budget Subcommittee on Health and Human Services, which a lot of this stuff lies into. We had people who were in places where we knew what was going on in the budget process. These things all mattered. This is all interconnected. That's what needs to be continued to be sustained by our community as well. These things do take time. Our success in pushing that is because of the work that has gone before us, both in politics and also in the community as well. So, for example, our Stop AAPI Hate Coalition, right? They came together before there was any money. They came together and said, we're going to start collecting this data, right? And reporting out on it. And because they did that, that gave us the data we needed to be able to make the argument for what we did. And then, of course, we were able to then include funding so they can continue to do that.
Now you're with AAPI Data. Can you tell us a little bit about your new role?
Well, AAPI Data is about data equity. So Dr. Krishan at UC Riverside, he's a social scientist who basically recognized that we don't have data on AAPI. And let me give you an example of this. I'm always going back to medicine because I'm a doctor, right? So I was faculty member at UC Davis. And one of the things I noticed when I read my research papers is that most research papers didn't have any outcomes for AAPI, right? So we'll see, like we call the famous table 1 in a research paper, right? That describes who the subjects were in the study, right? And so if it's about human subjects, you'd have, racial distribution, white, black, maybe Latino, and then other, right? We were usually lumped into other. There's been some studies looking at this phenomenon. So, for example, in JAMA, looked at NIH grants. About 0.2% of all NIH funding goes specifically to Asian American, Native Hawaiian, Pacific Islander focused research. 0.2%. So there was another study that was done. They looked at 5 of the top medical journals. They looked at the research papers that are published in human subjects, over 1,000 research papers. And they made note that of those research papers, only approximately a quarter of them actually even mention Asian American. Now, when I say mention, that doesn't mean outcome. So then they looked at those that mentioned Asian Americans and how many of them actually reported any outcomes. Only 10% of those that even mentioned Asian Americans mentioned any outcomes for Asian Americans. So we're 10% of the under 25%. So it comes out to be less than 2.5% of all research papers that were recently published in top journals included any outcomes for Asian Americans. We're not even talking about disaggregated outcomes, right? That's even smaller, okay? So when we think about all those NIH grants, federal grants, et cetera, that 0.2% that actually particularly target our community. And let me give you another example. Recently, and I love these people, so I'm being a kind critic here, but Kaiser Family Foundation put out a poll on gun violence, which got wide media coverage about basically different opinions about gun violence. They looked at what whites thought about it, what Latinos thought, what blacks thought about gun safety policies and gun violence. Boy, where are the Asian Americans? It's a national survey. If you look at the methodology section of the report, they say they drew a sample based on U.S. Census, distribution for different racial ethnic groups, but not one word about why they didn't get any results for Asian Americans. I mean, they could have at least said, well, we tried and there weren't enough. A month prior to that survey, there was actually a survey that was done. Actually, AAPI Data was involved. We work with Momentive. We actually did a survey where we surveyed Asian Americans and their thoughts about gun violence. And actually, of all the racial ethnic groups, Asian Americans had the highest concerns about gun violence and being, victims of gun violence. And so Kaiser Family Foundation, a month later, puts out their survey, and not one mention about Asian Americans. And all the news reports are about how Black and Latinos are concerned about gun violence, but no mention about Asian Americans being the most concerned about gun violence. I would call on people who do surveys like this, please say what happened to the Asian Americans in your sample, right? If it's too small, that's fine. It's not reliable, statistically reliable, but at least mention that we exist. Okay, that's number one. 2, if the numbers are too small, you can also cite other recent research that would give some in your discussion part. It's not your results part because it's your results. In the discussion part to say what happened. So they should have instead perhaps referenced our survey, which showed that Asian Americans may have even higher concerns. So at least show that we exist. And this is the fundamental problem, right? So here we have national news coverage, major newspapers, et cetera, saying that there's concerns about gun violence, particularly in minority groups, but why have we been left out? That's the problem. Our voice has been silenced. We've been made invisible. Okay. So what happens is that when people are trying to develop gun safety policies, are they going to think about talking to Asian Americans? Oh, well, I saw in the Washington Post that it's Black and Hispanics that are most concerned about gun violence, right? So we get left out. We didn't think you had a problem because you weren't mentioned. that's a data problem. And so what AAPI Data is about is we're really trying to work to build that data infrastructure. There needs to be data about our community. The problem is when there isn't data about our community, we don't have data to back up our advocacy when there's needs in our community. Frankly, I think NIH should be requiring any researcher who wants an NIH grant to commit to reporting on all racial ethnic groups, including Asian Americans, Native and Pacific Islanders. I think every research paper should also have either an outcome or mention why there's no reason for the outcome. And I would also say here in California, we're the third largest racial ethnic group in the state. There's no excuse for any researcher who's studying people, Californians, to ever put out a research paper or a poll or a survey that does not report outcomes for Asian Americans. And certainly we should try to include Native and Pacific Islanders.
Very strong points. We're almost at time, but I did want to ask this, and you don't have to answer, but do you have any future plans to run for elected office?
We were honored to have Jimmy Yee as the first Asian American mayor, but he was an interim mayor. He was not directly elected as mayor. So I am seeking to be the first Asian American mayor of the city of Sacramento.
Well, that's fantastic. I think that considering your track record winning an assembly seat and a state senate seat really puts you in a great position to be able to do that, and you'll be a formidable candidate. I personally would love to see you be mayor of Sacramento. It's a city that I love, and it's a city that is desperate for the type of leadership that you would bring to the table.
Well, thank you. Thank you, Bill.
So that's our time today. Thank you, Dr. Pan, for being on the show. We really enjoyed this conversation and really look forward to seeing what you'll be doing next.
Well, thank you so very much. And thank you, Bill, for your leadership and tremendous work you've done for decades in helping uplift our community and our state government. So thank you, Bill.
Thank you. All right, Ronin Nation, that's it for this week. We'll see you next time. If you are inspired by the exploits of the amazing Asian American badasses on the Ronin Project podcast and want to find out how you can learn more about politics or help Asian American candidates, click on the link in the show notes to join the Ronin Nation's national progressive movement to inspire, organize, and empower Asian Americans. Until next time, Ronins, roll program.